welcome to Unit 6, Lesson 1 of Principles of Health Science. Today we're looking at legal and ethical, specifically legal responsibilities. So first, let's start off by defining the difference between civil and criminal. So civil law focuses on legal relationships between people and the protection of people's rights. So they are between people and the protection of their rights. So people's rights. Now, criminal law focuses on wrongs against a person, property, or society. So these are known wrongs against certain things. Against a person, property, or society. Now, there are specific wrongdoings or wrongful acts that do not involve contracts that are part of civil law. So let's draw an arrow for torts being part of civil law. Now, torts are twisted, meaning that, so in Latin, torts mean twisted. Tortus means twisted. So when things are not spelled out clearly in a contract, things become twisted. So let's define what a tort is. A tort is a twisted, wrongful act without a contract. Now, what are some torts? Well, one of the most common torts that you've probably heard before is malpractice. Now, we're going to define all of these next, but let's just write them. Malpractice is a tort. Now, assault and battery is also a tort. So let's write A and B for assault and battery. What are some more torts? Well, there is negligence, and false imprisonment. So let's write false and draw a prison. That's not an exact representation of what false imprisonment is, but we will define it later. And defamation is also a tort. And then there is invasion of privacy and abuse. Let's say invasion of privacy. Let's draw a curtain. And it's going to be cut with scissors. Okay, we'll say that is a very bad curtain, but that is an invasion of privacy. Now, let's look at what each of these means specifically. Let's start with malpractice. What is malpractice? Well, as the name suggests, mal means bad and practice means practice. So it's just a bad practice or failure of a professional to the degree of skill and learning commonly expected in the individual's profession. So professional fails at stuff they should know how to do. So if a doctor accidentally stabs a patient somewhere they shouldn't be stabbed and it was an accident, but it's still a wrongful act and it's a bad practice. They failed to do what they were expected to do in their role as a doctor, as a surgeon. So the patient would sue for malpractice. Now, negligence, well, that sounds a lot like malpractice, but negligence is failure to give care that is normally expected of a particular person in a position. So this is give care. Now, what is the difference between tasks and doing your task and giving care? Well, giving care, this negligence is going to be a lack of care in any sense. So a caregiver doesn't do what they're supposed to do. It's not a professional. And then there's assault and battery. So what is assault and what is battery? Well, assault is to make a threat to injure, or reasonably scare someone in a way that is synonymous with a threat. Now, battery is the actual act of touching or doing something without consent. So, acting without consent. Now, this is not just in an abusive sense. If a doctor does something without asking you, or a paramedic does something in a non-emergency state without asking you, that's battery, acting without consent. That's why you're always going to ask your patients if it's okay for you to check something. Now, invasion of privacy is unnecessarily exposing an individual or revealing personal information about them without their consent. So without consent, let's say PHI dropping, personal health information, but it can also be other stuff. And then there's false imprisonment. So false imprisonment is not putting someone in prison for a false reason. No, like false imprisonment is restraining an individual or restricting their individual freedom. So your teacher is probably going to tell you a really big story about how they weren't able to get their car key and they were restricting the people at this car dealership were restricting their freedom. So if somebody takes your keys and says, I'm not going to let you go until you buy the car I'm telling you to buy, then that is false imprisonment and it's a tort and you can sue or get the police involved. So it is just restricting someone's freedom. And then abuse is care that results in physical harm, pain, or mental anguish. So anything that is going to harm, make someone upset in a really bad way. So this can be physical and mental. Okay, and then there is defamation. Now, defamation is false statements that either cause a person to be ridiculed or damage the person's reputation. So basically spreading rumors, false info about a person to harm them. Now, there are two types of defamation, and there is slander, which slander is speaking. And slander in the court is very hard to prove because when someone says one or a few things to you, well, you can't really prove it unless you have it recorded, right? And then there is libel. Libel is written defamation, and it is a lot easier to prove because if you have someone texting you mean stuff, well, you can just print out a transcript and show that to court. So it's easy to prove. Well, it's not easy, but it's easier. So I guess easy isn't the term, it's easier. Okay, so those are the torts that we're looking at. And now let's look at contracts. So contracts are the solution to torts because they are twisted things that occur when a contract is not present. And a contract is an agreement between two or more parties. So let's just define that. An agreement between two or more parties. So what are the parts of a contract? Well, this is very, very important that you know. So let's write them out. There are 3 parts. The first part is going to be the offer. So the offer is going to be, I'm going to give you 5 pieces of, I don't know, what's something that is traded a lot? 5 pieces of candy, okay, 5 pieces of gum. So there's going to be the offer. And then there's going to be, so the offer would be 5 pieces of gum. And then there's going to be the acceptance. So you're going to say, I want the pieces of gum. So you're going to accept. So this means I'm going to say, okay, and I'm going to be super happy about it. Okay? And then there's going to be the consideration. So what does each party get out of the contract? I get 5 pieces of gum, but what am I going to give back, right? So that is going to be called the consideration. So let's say I give you my amazing glittery mechanical pencil in response to the 5 pieces of gum. So those are the 3 parts of a contract. Now, contracts can be either implied or expressed. So what is an implied contract? Well, an implied contract is going to be non-verbal. So if you say that, can I check your heartbeat, or listen to your lungs, and the patient moves but they don't say anything, well, that's implied consent, right? They're moving and adjusting their clothes maybe so they can allow you to listen to their lungs. So it's going to be implied. Implied is non-verbal. Now there's also expressed. Now what is expressed? Expressed is going to be the opposite. Expressed consent is when they verbally consent to you doing something. So clearly stated, it's either verbally or written. So clearly written or stated. So this is a patient saying, sure, go ahead. And you usually want to get expressed verbal consent from your patients, especially minors, not just implied. You're in the office, so I'm going to check your heartbeat. No, like you need to ask if it's okay. Okay? And then there are such things as people who cannot enter contracts. Now, a contract is an agreement between 2 or more parties, but if you can't enter, who are you? Well, these are people with legal disabilities. Now that sounds like a big term, but I'm going to tell you now, you are actually a part of a legal disability. You are a legal disability. You have a legal disability because you are probably a minor. Now, this means that you don't have the legal capacity to enter a contract. So you can't enter a contract. You don't have what's known as the legal capacity or the ability to enter a contract. So let's say some types of people who have legal disabilities. Well, first of all, minors who are under 18. Okay? And then there's going to be people who are under the influence. So drugs, alcohol, under influence. And then people who are mentally incompetent. So they might have a psychiatric disorder and they can't think, or there's something wrong with them. So they are they might have a true disability, like they might have autism or something like that, which might make them mentally incompetent to enter a contract. And then there are semi or fully unconscious. So people who are in a coma, people who are maybe dead, right? They can't enter a contract. If you're not breathing, you probably can't enter a contract. So unconscious, you are breathing, but that's basically it. So what happens if you have a legal disability and you can't enter a contract? Well, let's go back. There are two types of contracts we talked about that are implied or expressed. So implied consent, express consent, but also these are types of contracts, right? Make sure to remember that. So if you can't enter a implied contract, or you can't enter an expressed contract, well, that means that you can't really consent to medical treatment in that sense, right? Well, that's not always true, because you should get expressed consent from minors because they have what is known as bodily autonomy. This was one of my biggest questions ever, because if they can't enter a contract, why do they always say that you have to get their consent? Well, you don't want to do something without consent, because that is, go back again, it all ties together, that is battery, acting without consent, and battery definitely applies to children. So contracts, if you're a minor, you're probably going to have your guardian or whoever takes care of you consent for you, but there are certain types of treatments and things that you don't need somebody who has authority or who isn't a minor to actually consent for you. You can consent yourself, and in that case, you don't have a legal disability in that category. But that's a legal disability. Now let's look at privileged communication. What is privileged communication? Well, privileged communication is all information given to healthcare personnel directly by the patient. So this is basically, if you think back, our PHI, right? Personal health information that is protected by HIPAA. Now, these privileged communications exist between doctors and patients, patients and nurses, patients, and anybody who works in the healthcare industry. And also, it exists between lawyers and their clients, because privileged communication also applies to law. So that's kind of cool to know. But they cannot be discussed with others not directly involved in patient care without the patient's consent. This includes spouses, children, etc. So if patient does not consent to the information being shared to their spouse or their children, it is still considered privileged communication, and it cannot be discussed with those people. So do not give PHI without patient's consent. and this includes spouse and children. Okay. And then let's look more at privileged communication when we look at healthcare records. Now, where do records belong? Like, who owns them? Well, records belong to wherever they originate. So let's write that. Belong to where they originate. This is very important that you know and is always tested. So healthcare records belong to where they originate. Now, this can be the hospital, clinic, doctor, wherever they came from. Now, the patient may obtain a copy, but usually has to pay for it. So, a patient can get, but has to pay. Okay, and then let's talk about maintaining healthcare records. So something important that you know, healthcare records are not some huge document all the time. They can just be doctor's notes and documentation, right? And records are legal documents that can be used in court. So that is something that we covered when we covered HIPAA. And let's write that again. They are legal documents. And this means that they can be used in court. And they often are. In personal injury situations and things like that. Okay. And if an error occurs, you have to cross out with a single line, insert the correct information, initial and date, and you may need to provide an explanation for the correction. Now, so that was something that we covered extensively in the HIPAA episode, and it's no erasures basically is the rule. Look back at the HIPAA if this doesn't make sense. But let's look at some things about ethics. Ethics are going to follow you through like every single little part of this class because it is a huge tested question. Now, ethics are different than law because legal is dictated by written laws and they're the same for everyone, but ethics are different. They are set principles relating to morally wrong or right. So, principles about morally wrong or right. Now, ethics change as we get older, and there are certain age groups that have different ethics and start to change their ethics, which you'll look at when you look at human growth and development at the end of the year. Morally wrong and right. And they are influenced by family, religion, and culture. You need to be able to name all of these because this is a select all but apply question usually. So they are influenced by 1, family, so let's write fam, and 2, they are influenced by religion, and they are 3, influenced by culture. Now, some people are going to say family and religion are a part of culture, and they are in AP Human, but let's just pretend that we don't know the correct definition of culture for this question. And what do? Well, they provide a standard of conduct or code of behavior. So ethics are going to create our conduct or our code of behavior, how we act in many situations. Now, what are basic principles of ethics that most people have? Well, saving lives and promoting health above everything else. So, do no harm is a huge part of healthcare, especially starting with Hippocrates, right? So save lives and promote health over everything. Make an effort to keep the patient comfortable. So keep patient dignity. Right? And respect the patient's right to die. This is a huge thing that you will also cover. Respect right to die. And we'll look more at that in a second. And then treat everybody equally. Treat patients, coworkers, everyone equal. I think these are pretty obvious, though. You should be doing this even though you're not in healthcare. And then provide care to all using the best of your abilities. So basically, work hard, give best care, I guess. And then maintain competent skill levels. So know your stuff. And if you don't, you need to polish it so you can give, again, your best care. And then pursue continuing education. So let's say CONT, EDU for short. Okay, so those are ethics. Now, something that we didn't define are patient rights. Now, what are patient rights? Well, this doesn't provide a list of patient rights, but let's say patient rights are going to be factors of care that patients can expect to receive. So, factors of care patient is in control of. And some of these patient rights give way into legal directives. Now, what are legal directives? Well, legal directives are the way somebody wants things to happen for them. So, the first legal directive is the durable power of attorney, and it is a document that allows individuals to appoint another person, an agent, or sometimes called a proxy, to make decisions for their healthcare if they, the principal, should become unable to make these decisions. So a document that allows patients to pick someone, appoint a agent if they can't make the decisions themselves. Okay, so durable power of attorney is when someone is incapacitated or they are unable to make these choices because they are unconscious. Okay, so now the general power of attorney is not in your notes, but it is important to consider because your teacher's going to bring this up and you're going to get confused. So durable power of attorney, well, durability is the ability of something to bend. And I think when something bends, it changes state, and state is still valuable, right? So durable things are still valuable no matter what. And that gives way into the durable power of attorney, because durable power of attorney allows somebody to appoint an agent and have that agent make choices for them beyond being unconscious. So durable power of attorney is when somebody picks another person using like a document and writes it out that makes choices for them when they can't make choices because they are usually unconscious. Now, general power of attorney is the same thing, except when they are unconscious, the general power of attorney ends, right? So they make choices, but it ends. That's their job, but it ends when somebody turns unconscious. are incapacitated. Now, living wills are documents that what level of care a patient does or does not want should they become incapacitated. So when they pass, or when they are unconscious, or they're about to pass, they can write out what type of care they want. Now, a popular part of a living will that's sometimes held are DNRs, or do not resuscitate, which means that somebody does not want chest compressions and CPR when they pass. And this can be done for a variety of reasons, but you need to ethically allow this as a doctor, as a health professional, because this is somebody's right to die. And if you bring someone back when they're living in terrible conditions all the time that they're alive, and they have a DNR, and you don't let them peacefully die, then you committed a crime. So don't do that. Living wills write out what level of care someone wants care for when they can't decide. For when they become incapacitated. Okay, so those are legal directives. Now there are a few more things that are in the notes called professional standards and how to stay out of trouble, but I think we covered all of them. I'll just read them here. But only perform procedures for which you have been trained, and that is the standard of care. So let's write standard of care should be a good part of your ethics too. Or not standard of care, your scope of care. So scope of care is only performing things you are certified to do. Okay. And then only use approved methods for performing a procedure, so know your stuff. Obtain proper authorization before performing procedures. Again, scope of care, if you need authorization to do something, you need to get it. And identify the patient and obtain consent before performing procedures on the patient. So this is why doctors often say, can you confirm your name and date of birth before they do an exam on you or something like that, because they want to make sure you have the right person, because if you don't and then you give out the PHI, well then there you go, you just committed a crime. Okay, and then they observe all safety precautions. Again, know your stuff. Keep all information confidential. PHI, HIPAA, important. Treat all patients equally. Everyone equal, not just patients. And then accept no tips or bribes for care you provide. So that's very important. You don't take tips or bribes when you are a health professional. And there are often limits on how many gifts you can take or how much money the gifts can cost and things like that. And then if any errors occur or if you make a mistake, report it immediately. That is integrity. And behave professionally. Now that you need to do even as a student. So that is a personal quality of a healthcare worker. So that is legal and ethical responsibilities. I'll also link in the HIPAA information, because I think a lot of it ties into the playlist. So that is legal responsibilities and ethics.